VERKICHARLA. Please, his talk is near work or outdoor time. Which one is the culprit for myopia progression? Please.
Very good afternoon, everyone. Last talk of the session, and before lunch, you can't ask for a better timing. I will quickly talk about the near work or the outdoor timing, which one is really the culprit. But before I go into the details, I think we all agree that this is the need of the hour given the current lifestyle situation, not just in one country, but I think this is a situation wherever you are. And also, one side we have strategies that can take care of the near work, and on the other side we have strategies such as glass classrooms, which bring in more light. Now the debate is it more near work? Do you control the near work, or do you push them to do more outdoor? Before I share my views, I want you to raise your hand if you think near work is the culprit. Fantastic. Audience are still awake. How many of you think time outdoors is the culprit? Oh, very few. All right, now I know which way to go. All right, so I think a disclaimer is I think we do not know a lot. I would say that we know nothing in the field of myopia. Like Dr. Saxena has already indicated, we are only scratching the surface. Unless we get it up with the evidence at multiple levels, I think we will not be able to make major conclusions. So to do that today, I will be relying a lot on the recent evidence that has come out and a few of the experimental work that we did in India as well. So when we talk about the myopia management, we have largely treatment options all the way from environment, lifestyle modifications, of course, and then the options in the spectacle contact lens and the pharmacological. Now, when we stick to the environment, we rely on multiple hypotheses. Time outdoors is great. What could be the reason? Is it the light levels are much more higher in the outdoor environment? For example, if I take a lux meter right now, it could be maybe 300, 400 lux. If I step outdoors right now in Delhi, I think maybe it will be 30,000 lux, or even more than that. It can go to 80,000 lux as well. Now, is it bright light, or is it the spectral composition of the light itself? We talk about the red light therapy. There are evidences coming out to say shorter wavelength of light is also important, like the violet and the blue and the cyan as well. Now, if you're outdoor, is it really light, or you're not really reading, which means relaxed accommodation, which means it's a substitution effect? Or is it the better depth of focus given the pupillary constriction, enabling better visual acuity? There are debates about is it vitamin D or the exposure to the UV, and the dopamine release when you're in outdoor, the macrine cells release inhibits the eyeball from growing. Now, these are the different mechanisms, but if you want to bin them into two, it boils down to near work and the light. And more recently, when we talk about near work, we are debating about is it hard copy or the more screens. Now, when we talk about light, is it the broadband light, or is it just the time outdoor, or maybe a specific wavelength of light? So this is a systematic, well, I don't say systematic, but it is an overview of systematic reviews. There are 7 systematic reviews that we considered to do this analysis, 47 studies, or the primary studies, involving 63,920 participants. This is already published in OPO a couple of years ago, and clearly indicates that the myopia incidence has reduced, much like the previous speakers already indicated. You can sort of prevent or delay the onset of myopia if you put them in outdoor environment. Now, whatever philosophy it is, various proposed mechanisms, but the myopia prevention is on the go. But what happens to the myopia progression? So the evidence, again, 7 systematic reviews, overview, the topmost evidence generating way, it indicates that the role in slowing myopia progression remains controversial. Given that statistically you may see the effect, I got that on the last line where we show that about 0.03 millimeter compared to the control group, or if you equate it to the diopters, it's 0.13 diopters. What it means clinically is a debatable zone. So this sort of indicates that, okay, time outdoors is great for pre-myopes, fantastic, and maybe for myopia prevention as well. So what else do we know about the time outdoor situation? Now, Dr. Saxena already indicated, we do not know what's the location that the child is in. We say in our prescription time outdoors, 1 hour, 2 hour, whatever, but we do not mention what time of the day. In fact, we do not know what time of the day is really beneficial. For a child and the mother, maybe playing in the parking area is outdoor. When you ask them in the clinic, they say outdoor, of course outdoor, 1.5 hours in the outdoor every day, but you probe deeper, you will realize that they're actually in the indoor setting, and that's not good. So we tested this in multiple locations, open play area, under the tree, in the canopy, within the closed doors as well. So on the left side, you are looking at the ambient light levels at different locations, and we found that the light levels, even though they are outdoor, for example, if I'm under a tree, I'm in outdoor, but if you look at that, the light levels under a big tree are below 1000 lux. So below 1000 is a cutoff that we consider that you're in outdoor or indoor environment. So outdoor is not really outdoor for myopia. So what is outdoor? I think we still do not know. And add to that, the spectral composition is also very different. The magnitude of the spectral power distribution of the RGB components is much lower in indoor, whereas if you go outdoors, it's 100 times more, as you see on the screen there. So we also went on to look at this in India, where we developed the light tracker and then said, okay, let's give it to the children and then see what's really happening. First step, we gave the tracker for a few weeks, 143 children. We looked at what is the illuminance level, what is the time outdoor time, and how many times do they actually go out. If I step out, come in, that's 1 minute, or one time I get one outdoor. We call it as epoch. And we found that the differences between the emmetropes and the myopes is seen only during the break or the transition time. Otherwise, there is not much of a difference. And we are also looking at longitudinal data. Again, the progression seems to be not so different in both the groups who are exposed to more light or the low light levels. So maybe the transition time and the breaks could be important. Now, the data coming out from the Singapore indicates that intermittent transient light exposure could be sufficient for the eyeball to regulate its length, meaning you don't have to tell maybe 60 minutes continuously. It is possible that maybe even some sports are good enough. Again, this is only speculation at this point of time, that while there is a school break, maybe the child is still in the indoor setting and not really in an outdoor environment. But whenever they get outdoor, it is possible that they're getting that the shot of the light that's required for the eyeball to be regulated. And again, Dr. Ming has already spoken about the red light therapy. There's information about the violet light, and we have some evidence coming out to say that the blue light sort of inhibited the eyeball from growing. Again, this is done in humans a few years ago. And we're also looking at something like a wearable. Again, this is a research mode at this point of time. We do not know which way it will swing. What we also do not know is it mesopic light level, or do you really need such a high light exposure? Now, moving on to the near work, multiple theories, accommodative stress, or is it the accommodative lack? The mechanical tension theory relies on the accommodative stress, more ciliary contraction, and then eyeball could expand if you believe in the equatorial stretch of the model. Now, we did an experiment where we gave hard copies, reading on a mobile, and reading, watching a video. And we said, okay, what really happens to the eyeball length? Same distance, same reading time, what will be the changes? 15 minutes of near work. This is already published in 2021. Now, the results indicate that if you're reading on a hard copy, there are changes in the eyeball length are much more compared to while you're reading on a smartphone. Watching on a video, even lesser. Now, video is a temporal domain, maybe there's not much of an accommodation, whereas if you're reading on a hard copy, there is contrast difference, the resolution is much more higher, you're accommodating a bit more. And we support the mechanical tension theory. Now, is it questionable outcome? The mobile phones to the humans are available only from 2008, and this is no joke. Myopia is already high in various East Asian countries before 2000. If you see the graph, it peaked 80% already in 1990s already when there's no mobile phone. So it's fair to say that maybe hard copy could be triggering as well. So any near maybe closer working distance could be the one that could be triggering. We also asked another question, the major question, okay, is it time outdoor or near work? Can we get same individuals read in outdoor, the 80,000 lux level, bright sunny day, and also read in the indoor, same working distance, everything same, 15 minutes of exposure, these are individuals, same, and we found that wherever you are, if you are reading, eyeball length went on to elongate. So same people, same task, if you're in outdoor, doesn't matter, the mechanical stress seems to be dominating. So people ask, all right, I will make my child sit in outdoor or a balcony, and can I make them read? This is a common question that I get from the parents. So we say no, given that there is some evidence. Again, we do not know, is it physical activity that's more important, or is it light, or is it staying away from near work? I think the puzzle is not answered yet. Now this is the question I asked, near work or time outdoor? I think it's more near work, less outdoor, closer working distance could be the one. I think there is some interaction between these two that's playing a role with domination of the near work. Overall, I think the puzzle seems to be still unsolved. Time outdoors, great for the myopia prevention. Near work seems to dominate and maybe minimize the productive effect of time outdoor. Lifestyle modifications, I believe, in the clinics are much more oversimplified. You might want to indicate where exactly they have to be, how much time, be much more realistic. And we always talk about 20-20-20 rule. For a child, maybe it's a little difficult. Again, we need to know an evidence. Maybe if you can advocate one-arm distance, take frequent breaks, or maintain that distance. I would like to acknowledge my team and also invite you for the 5th Indian Myopia Awareness Conference. That's going to be in India in 14 November. Thank you for attention.